Our next innovator is the Massachusetts Public Health Association on the track titled Building Healthy and Sustainable Communities for All, which is sponsored by the Osprey Foundation. Rebecca Gurwitz is the Executive Director of the Massachusetts Public Health Association. Rebecca received her master's degree from the McCormick Institute at UMass and has 15 years of experience in public policy, local and state government, and community organizing in Massachusetts.
The Massachusetts Public Health Association is a membership and advocacy organization dedicating to achieving state and local policy change to make all Massachusetts communities healthy communities. I'd like you to imagine a woman who goes to the doctor for a routine checkup and learns that she has type 2 diabetes as a result of her weight. Her doctor recommends changes to diet and exercise. But then she goes home to a neighborhood in which there are no parks or open space, so there's no place to exercise. The sidewalks are absent or in disrepair, so she can't even go for a walk. And her options for healthy food are extremely limited. There are no grocery stores in her neighborhood. The corner stores stock mainly processed, highly unhealthy food, and her only other options are fast food restaurants. Healthy people depend on healthy places, and some places are much less healthy than others. The neighborhood I described is a reality in many Massachusetts communities, and indeed across the United States. Massachusetts, despite being one of the most affluent states in the nation, has fewer supermarkets per capita than almost any other state, ranking third lowest nationwide. Low-income and African American and Latino communities like Springfield, Brockton, Holyoke, Lawrence, parts of Boston are disproportionately burdened. These communities also have fewer places for physical activity and higher rates of violent crime. The differences in the health of these neighborhoods lead to startling and stark health disparities. In Boston, this is a picture of Boston, in Roxbury, if you live between Dudley Ave and Shawmut Ave and Dudley Street, you can expect to live to be 59 years old. If you live just across the street, just across Mass Ave, you can expect to live to be more than 84 years old. These this problem obviously has moral costs, but it has economic costs as well in the form of higher costs on healthcare and in lost productivity. So what can we do? It's not enough for doctors to urge people to eat healthier or exercise more if their neighborhood prevents them from doing this. We must invest in systems change to change these outcomes and create healthier communities. At MPHA, we have an effective model to do this. First, we convene partners from communities most impacted by chronic disease. Together, we identify common issues. The communities I'm talking about are the ones that I described earlier. Then, we educate groups on how to mobilize, how to get involved in the state level. We teach them how to talk to legislators, how to write letters to the editor, how to write op-eds. And then at key moments, we mobilize them, like when a bill is about to have a hearing up at the State House or when we plan a rally. This work builds the capacity of local leaders to engage others on the ground in their work. The result? More powerful advocates working for state and local policy change, creating healthy communities and health equity. This approach works. In 2014, we convened 23 partner organizations from across the state to advocate for the Massachusetts Food Trust Program. This program, once funded, will allow grocery stores to come into the communities that need them the most, and will allow corner stores to expand to include more fresh and healthy options. Healthy food financing and healthy food work are just one of the issues where we focus and we spend our time. At the Massachusetts Public Health Association, We also work on changes to the built environment, housing and family stability, violence prevention, and a host of other core essential public health issues that we decide to prioritize based on the work that's going on the ground, based on the work of our community-based organizations that we have mobilized. We seek to build our capacity over the next 2 years because we need more trained advocates and community-based organizations working in our coalitions, building the momentum for change across the state. We seek an investment of $1.1 million. We seek to raise this over the next 2 years in order to continue the work that we already do and expand this work. We know that if we do nothing, today's generation of children will be the first with a shorter lifespan than their parents, and the social and economic costs will continue to rise. But what we also know is that we can create a Massachusetts where inequities are reduced, costs are saved, and communities are healthier and stronger. We've proved it, and we hope you will join us in this important work. Thank you.